So yes, my name is Patricia McEachrane-Gross, and most of my patients and staff call me Dr. McG. It's a lot easier. So this evening I'm going to talk about treating the type 2 diabetes patients with a plant-based diet. So the goals of this talk, at the end we should be able to answer the question, does a vegetarian or a vegan diet reduce the incidence of diabetes? We should also be able to answer, does the vegetarian diet improve glycemic control in diabetic patients? And then we're going to apply this information to one particular person, and I'll also give you some additional information from my own experience and practice. So this graph covers 1961 through 2007 with the growth in meat consumption in the US. And it actually looks very similar in the rest of the world. We're not the only meat consumers. And this is through 2007. It's expected to reach a record high in this year. 2018 was very high. The numbers actually differ according to the source, but you know, this is amazing that one person consumes about 275 pounds of meat in 1 year. That is pretty amazing. And what we see over the same period of time, and I don't know if it's I'm colorblind or we can't really see the colors here, but basically what this slide really looks like is that over that period of time, the prevalence of overweight actually remains about the same, but the prevalence of obesity and extreme obesity increased over that period of time. So going along with the increase in meat consumption. You know, going back to this issue of increase in meat consumption, I think we all recognize what it takes to, you know, have meat on our plates, the effect that it has on our environment, the effect that it has on our climate. And it's pretty amazing that, you know, we continue knowing the effect that eating meat has on our environment and climate change, and yet it's increasing rapidly, not just in the US, but the rest of the world. So the prevalence of type 2 diabetes, both diagnosed and undiagnosed, and you know, what they've done also is send out questionnaires with capillary, the ability to do capillary blood samples to patients, to people, and ask them if they have been diagnosed with diabetes. And they sent back their blood samples, and it turns out that a lot of people don't recognize that they are diabetic. And so the actual cost of care is more than we recognize when we have all of these undiagnosed people in our population. So in 2015, in the age group of 18 years or older, there were 30.2 million people who were either diagnosed or undiagnosed diabetes, accounting for 12.2% of the US population. And that number is 12.0 million in those who are 65 years or older, and that's 25.2% of that population. Well, we do know that vegetarians have a 45% decreased risk of being overweight or obese. Vegans, plant-based people, have a 65% decreased risk of being overweight or obese. And on average, vegans are 30 pounds thinner. We know that a healthy BMI range is between 18 and 25. On the typical standard American diet, the average BMI is 28.8, which is overweight. And the average BMI on a vegan diet is 23.6. So we can already see that difference, and beginning the relationship with diabetes. So this slide shows the semi-vegetarian or flexitarian diet. You know, I eat a plant-based diet most of the time, but when I get around my friends and my family and I don't really want to offend them, I eat some chicken or a fish to, you know, ease the situation. So semi-vegetarian diet opposed to the vegetarian and the vegan, you can see that as the diet becomes more plant-based, there is a reduction in the prevalence of type 2 diabetes. And this was, this came from a study among California Seventh-day Adventists. And, you know, in general, Adventists don't smoke or use alcohol. So the difference was seen clearly, the diet difference was seen clearly in this population. So again, the same population showing the change in BMI, the relationship with diabetes, as well as high blood pressure. So the non-vegetarians, the BMI average was 28.26. The relative risk of diabetes in that group was 1. And the same thing for hypertension. And you can see the relative risk decrease as we move towards becoming vegan, as well as the BMI. So very clear in this group of people. So what is the relationship with blood glucose and insulin resistance? In the standard meat-centered diet, where the fasting glucose measures about 105 and the insulin level 7.32, insulin resistance is considered normal when it's like between 0.4 to 1.1, just about 1, just over 1. And in the group that's eating the standard meat-centered diet, insulin resistance is higher. Now, it's considered pretty serious when it's about 1.9. But in this group, the average is about 1.5, and this was a study done in Europe. For those on a vegetarian, not even a vegan or whole foods plant-based diet, but on a vegetarian diet, the average glucose is lower at 80. That's the fasting glucose, with the insulin level at 4.96 and a normal insulin resistance, less than 1. So you can see the difference even with a vegetarian diet. In the Black or African American population, once again done in the Seventh-day Adventist study, diet does make a difference. So diet in any race makes a difference. So when you look at the vegan versus the non-vegetarian diet, what do you see as far as the relationship between the diet and diabetes? So it's not, it's not a race issue. When anybody uses this kind of diet, it's helpful. So you can talk to your different populations about the plant-based diet. I know that many cultures have meat as the center of their diet. Is anybody in the room Filipino? What is the Filipino cultural diet?
It's like Asian soul food.
Asian soul? Is that what you said?
A lot of pork.
A lot of pork. A lot of pork. And what do you find when you talk to Filipinos about plant-based eating? Is that very difficult to accomplish?
Absolutely.
Yeah, it's very difficult to accomplish, but you probably doing studies in the Filipino population would show this same result if we changed the diet. But getting through the cultural barriers is something that we all have to deal with, and show the results of going to a plant-based diet, and actually cook food that's appealing to the Filipino culture, that's plant-based. So knowing how to have appealing food for the particular culture is important. So this slide is about the efficacy of treatments compared. And so the first row is about the American Diabetes Association diet with metformin, and then the low-fat vegan diet. The low-fat vegan diet embraced like people like Neil Barnard as PCRM, and also Dr. Esselstyn. Low-fat vegan diet, they all emphasize the low-fat vegan diet. And what we see is that you have more reduction in the hemoglobin A1C with the low-fat vegan diet. Now, for some people, that there's already the thought, well, that doesn't sound too palatable, but it can be, and we'll talk about that in a few minutes. Weight loss is increased in the low-fat vegan diet. The reduction in the LDL cholesterol is better in the low-fat vegan diet. The reduction in urinary protein damage, signs of damage being done to the kidneys is better. That reduction in the albumin is better in the low-fat vegan diet. And on a low-fat vegan diet, patients are generally able to reduce their medications. And that's another cultural thing. Many cultures, patients don't want to take medication. Now, they don't want to eat better, but they don't want to take medication. So, and I think that's even stronger than not wanting to eat better. So we have the goal, the challenge of letting them see how food can actually taste good. And they can, yes, maybe not take as many medications. So in type 2 diabetes, diet matters more than exercise. And this is what this study bears out, in that patients were asked not to exercise. And it turns out that their mean fasting glucose in the experimental group decreased from 10.7 to 7.75, that is, in our measurements here in the US, 195 to 141. and the mean weight loss was about 15.8 pounds. So even without exercise, diet is helpful. And we all know this by now, that Hippocrates said these famous words that we all believe in. So in medical school, as we all know, the missing ingredient is learning about nutrition. And 14% of this group, resident physicians, felt physicians were adequately trained to provide nutrition counseling. Only 14% felt that way. And 2% of residents availed themselves of courses in nutrition when offered in medical school. Lack of interest, lack of time, feeling that, maybe it's not going to be that valuable anyway. And we all heard from the past president, the first vegan president of the American College of Cardiology. I don't know if he'll go on to be the only vegan, but he was the first vegan. Teach your patients how to shop. Emphasize meats and dairy substitutes. Teaching patients how to shop. Well, if you don't have time to teach patients how to shop, maybe there's somebody in your practice, whether a nutritionist, a dietitian, somebody who really embraces the plant-based lifestyle, can teach the patients how to walk the perimeters of the grocery store and get all their good foods on the outsides, never having to go down the aisles. No, but this is really important. Patients, patients may be lost even after you give them good information on how to transition to a plant-based diet. They go into the grocery store and they're lost. They don't know what to do. They have difficulty reading labels. So somehow that has to be done, whether in the actual grocery store or in a setup in the office that allows them to see how to do this. So writing the prescription. I think writing the prescription is the first part of helping a single patient learn how to go from their heavy meat eating, and certainly using the techniques of, well, what do you think you can do? You eat cheese every day. Do you think you can go to a 1 day without eating cheese? 1 meal per week without eating cheese? What do you think you can do? And if you get a patient to say what he or she can do, they're really excited to come back in general and let you know that they have accomplished that one thing that they said they could do. Yeah, even if it is just giving up 1 meal in the week that didn't have cheese, 1 meal that didn't have meat. He said, can you do that? And they agree yes, and when they come back, they're excited to let you know that they can do it. So explaining the efficacy of the dietary intervention, showing them all the information that you have, that you've seen here, that's on the websites, whether it's Vegetarians of Washington, all the scientifically based evidence, whether it's from Neil Barnard, whether it's from Esselstyn, showing them the numbers, emphasizing that it's safe. They're not going to drop dead from eating more plant-based meals that week. And they're not going to die of hunger. Showing them how to fill up the plate with good whole foods and feel good. Prescribing a specific plant-based diet in writing, or just writing, okay, this is what you're going to do this week. And soliciting support from the patient's partner, especially with men, you know, getting buy-in. And it's still that way in, what year are we in, 2019? It's still that way that, you know, women drag their husbands to the doctor, or they come to be sure that he's saying what he's supposed to say, and you still need to get buy-in in general from the women in the relationship. And yes, integrating with standard treatment, and also as time goes on, letting them see again that you can have a reduction and sometimes elimination of medication. But don't start off the average patient, you know, by dropping their medication. But I'm going to show you something that from, well, an Immersion. And reassess symptoms and lab values. Lab values are your friend. Getting the labs done every 3 to 4 months and showing them the decrease. You know, don't wait 1 year to get the next set of labs done. If a patient is really enthusiastic about following this whole foods plant-based diet, show them the difference with the labs. They become excited. They're like, wow. And they do become excited when they see their values improve. Reassess symptoms and lab values frequently after beginning treatment. So when I had my private practice in Florida, when I started out as a solo practitioner, one of the ways I made money to support this practice was that I worked with Whole Foods. They had a total health immersion program. They still have it, at least in Naples, Florida. It still exists. I don't know if Whole Foods in this area does that, but they send their employees who have problems with diabetes, high blood pressure, weight issues. They pay for 1 week a really nice place, in Florida, it was in Naples, a nice resort. They pay all their expenses. They would even pay 50% of the spouse's expenses if the spouse wanted to go. And basically, they were immersed in a whole foods, plant-based diet. None of the processed food stuff. And the doctor who ran the one that I participated in, his name is Dr. Stoll, and he and his staff worked a long time with the hotel staff to show them how to cook, prepare tasty, whole foods, plant-based diet. They worked with them. And at least when I was going, the food was pretty awesome. And there was a lot of food. I couldn't eat breakfast, lunch, and dinner. It was just too much. But it was good food. And these patients, or these employees came, and I was there primarily to decrease their medication as they went along the week, and monitor them for symptoms of blood pressures and blood sugars dropping really low, or people who were getting off caffeine, the symptoms that they were having. So that was my role in this Whole Foods immersion. So this person, 27-year-old male, was first diagnosed with diabetes in 2003 with a fasting glucose of 207, and that's all the information we had, and a total cholesterol of 250. And at the time, he was treated with glipizide and metformin. When he presented to the Immersion as a Whole Foods employee in 2011, he was 35. His weight was 313 pounds. His fasting blood sugar was 159, blood pressure 130/80, cholesterol, total cholesterol, because that was what was measured on the first day of the Immersion, 189, and he suffered from heartburn. At that point was on glipizide, metformin, lisinopril, Lipitor, and Tums for his heartburn. So on day one, because this was going to be a total immersion, he was taken off his medications except for the half a tablet of metformin, which was now 250 milligrams, his Lipitor, and he was continued with Tums as needed for his heartburn. So that was on day one. By day three, he had stopped his metformin due to his blood sugar dropping really low and feeling dizzy. And he noticed that his reflux had improved. This was on day 3 of a total immersion. And by day 8, the end of the program, he had lost 5 pounds. He had stopped his Lipitor. His fasting glucose measured on day 8 was 129. His total cholesterol, I think that's an error, but his total cholesterol was about 152. His blood pressure, so this is blood pressure, okay, you said this is the same as when he came in, but when he came in he was on lisinopril, so off lisinopril his blood pressure was the same, 130/80. And he was followed up, and he was one of the people who came back the following year to be excited and to encourage other people. So at day 120, he had lost 45 pounds. His fasting glucose was down to 100. His total cholesterol was at 202. His weight continued to fall, and his fasting glucose continued to go down. So did his cholesterol. And almost 1 year later, he enjoyed the food so much, he stuck with it, and he came back, like I said, as an example of what could happen on a whole foods, plant-based diet. So this is one way to deal with patients. You can send them to a program like this, because it's not just Whole Foods that does this. There are other places, there are other lifestyle centers that do the complete immersion. And so in this particular instance, in this total health immersion program, it's primarily diet, because the candidates spend a lot of time sitting in the classroom learning about the diet, learning how to make the change, learning the science behind the diet. And they do have about 2 exercise classes per day, 15 minutes, each. So it's not that they're out there exercising, it's all about the food. And the food makes that difference in 8 days. When we're in an office, our patients generally don't get to be in this total immersion program. You can send them to these types of programs, but they experience more gradual change. But this information can be presented to our patients, showing them the difference of what an intense program can do. And there are lifestyle centers all around the country that do this kind of thing. And so you can refer patients who are interested, motivated to these types of programs. But we also can do, as physicians, if we're really interested in, and we embrace what we say, the whole foods, plant-based diet, and that is what I emphasize, whole foods, plant-based diet. We really can do this by doing something like a dinner with a doc. So you get a group of patients together and you tell them that, you talk to patients individually, find out would they be interested in something like this, and then you get a group together, you give them scientific information, and you let them taste good food. You give them the recipes to go home with, and that helps. You also can do group visits. Group visits are big right now in medicine, and you can do group visits. And when patients get together in a group, they become excited hearing the results from other patients. So that's something else that can work. One of the things that I started doing was lab values, bringing patients into a group visit to explain lab values. So I would, they would have their lab results, and I would put information up about, what LDL means, what the high sensitivity CRP means, and you get questions, and you get thoughts, patients sharing information. So that's another way that we can help patients achieve the results that they desire and makes them feel good. So yes, it is difficult, and yes, you have to deal with each patient where he or she is, but your interest in the patient's well-being, they see it, and they want to please us. And once they see that food actually tastes, whole foods, plant-based diet food actually tastes good, many of them are willing to make that step. And if you can make it cultural, have lots of good cultural dishes available. Not just, brown rice and beans, but lots of, Filipino dishes, Mexican dishes, vary the dishes so that people can see in their culture, plants still taste good.